Hi there, I'm Dr. Debbie, and I want to welcome you to this MasterClass, A Wise Woman's Guide to Couples Counseling. Okay, so what are we going to cover today? Well, first of all, we're going to talk about why you're here. Everybody has a different reason that they've shown up on this particular masterclass. Something's going on in your life. Either you're in counseling and you're a little confused about what's happening, your counseling isn't moving as quickly as you would like for it to. There's just lots of different reasons why you might be here in particular, but there's some other reasons too that kind of underlie that. We're going to go over those. Hello, I'm Dr. Debbie, and I've been helping men, women, and couples grow together for more than 25 years. Now it's your turn to learn what I learned and taught as a couples counselor and university professor. This is your personal development podcast packed with instant encouragement and practical tips. This is a safe place where women are valued and men are respected. We talk about biology, socialization, behavior, emotions, communication, and connection, because men and women are different. Always have been, always will be, and that's a very good thing. The second thing we're going to cover is various counseling models, both individual and couple models. Then we'll move into the counseling process. What's it like to be in a session? What's it like to be in a spot where you actually have achieved your goals? Then we're going to move into what I consider to be the missing piece in how we approach couples counseling. Then the part that you're probably really excited for, which is how do you speed up that process? How do you know you're making progress, and what can you do as just one person to make that process move more smoothly, more quickly, and get more positive results from the experience? Then finally, we're going to talk about the what ifs. There's all kinds of things, all kinds of exceptions to everybody's story. We have some things in common. Many things are very specific to us. So we're going to cover some of those exceptions in this masterclass today as well. Are you ready to dive in? Before we get too far, I think you're going to want to know what in the world qualifies me to teach a class on couples counseling. Well, I do have a doctorate, but you may not know what that doctorate is in. So I started out with an undergraduate degree in regular psychology from Mid-America Nazarene University. That's actually in Olathe, Kansas, which is it's actually a suburb of Kansas City. So I have to just say I went to college in Kansas City. Then I moved to California, and I went to Rosemead School of Psychology at Biola University for my Master of Arts in Clinical Psychology and my Doctor of Psychology in Clinical Psychology. So if you see, that's lots of psychologies in there, isn't it? Kind of confusing, but that's how it goes. So I moved from Southern California, then I moved back to Kansas, and I did my pre-doctoral internship at Watkins Health Center. They're on the campus at the University of Kansas. The Jayhawkers, if you've heard of them, they've got great basketball teams pretty much forever. So if you're a Jayhawker fan, I was there to cheer on the team and to counsel the students while I was there finishing up my requirements to get my doctorate in clinical psychology. While I was there, I also taught a course back at my alma mater at Mid-America, which is just about 45 minutes from KU's campus. So that was pretty cool. Then I moved back to Southern California, and I started teaching at Azusa Pacific University. I taught undergrad psychology there. I also, after a couple of years, picked up a class back at my other alma mater at Rosemead School of Psychology. I taught both undergrad and graduate psychology at Rosemead. I loved being there with my professors and my colleagues. It was just a really fun time. I had great classes at both schools. I was also doing clinical psychology, so I had a clinical practice. I was all over the map in Southern California, so I know the freeways like I know the back of my hand. Anyway, after a while, then I decided I would just do clinical psychology, and I got away from teaching for a long time, except that I taught Prepare Enrich. I was a facilitator for that for, close to a decade, I think, that I was training other counselors in how to work with couples. So those are some interesting things about me. Makes it sound like I had it all together, doesn't it? To go through all that education. and no indication of any of the struggles that I had with that. And trust me, I could spend hours talking about the things that I went through in doing that. The reason that is because without a dragon, there's no story. You've heard that before, right? There's every movie you watch, every book you read, every story you hear, something goes wrong, something goes south. And for many of us, those things happen very early in life, as they did for me. This is a picture of me with my father. Now, I was about a year old there. I think it was just under a year old. And it wasn't too long after that, before I turned 3, my mother packed my brother and I up one day and left town while my dad was at work. I didn't see my dad again for 37 years. And that's why I think I identify so much with Rapunzel in the story Tangled by Disney, because I really was a lost princess. I didn't know who I was. I didn't have a father because I lost him so young. I didn't even realize that it was not normal to not know your father. Now, some of you may be in that position too, and trust me, my heart goes out to you because it does skew your view on life tremendously. Then, when I was about 7, I encountered shame for the first time. It was just the most painful experience that I had. This is me in my Bluebird uniform. We had gone to the radio station in the little town where we lived in southeastern Kansas, where we got to talk on the radio. And the announcer went around from Bluebird to Bluebird and said, "What's your name? What does your daddy do?" And he came to me and he said, "What's your name?" And I said, "Debi." I was so excited. I loved being on the radio, even though I'm not sure I really knew what that meant at 7 years old. But I said, "My name's Debi." And he said, "And what does your daddy do?" And I very matter-of-factly just announced, "Oh, I don't have a daddy." And the guy looked like somebody had just slapped him. I mean, he moved to the next girl as quickly as he could. I knew I'd done something wrong, but I had no idea what it was. And so I spent most of my life trying to be normal, but having something going on inside of me that I much later identified as shame as the reason that I held back so much. I'm an extrovert. I put myself out there, but then I'd worry, am I going to do something wrong? What's happening here? And I would pull myself back constantly. Maybe you can identify with that as well. And then I got married when I was 18. Some of you know that. It was the summer after my husband's first year of college. We had both graduated from high school at 17. We got married the summer after his freshman year. 6 weeks after he graduated, our first son was born. Then we had 2 more sons and we moved around a bit. That story, you can hear about on my podcast if you want to hear the whole story. But one day, I remember it was in May, he told me he didn't think he wanted to be married anymore. I had a high school diploma. I had 3 boys. I was in a town where I knew hardly anybody because we had just moved to the Kansas City area. In that process, I was a hot mess. This is a picture of me that's actually my senior picture in high school. When we got married, that was my engagement photo in the local newspaper. So you can see, at 18, the picture was probably taken when I was 17 because I hadn't graduated yet, but that's pretty young to get married. And I went through lots and lots of struggles. Again, way too many to mention, but I want you to know that I've been a single mom. I've been through divorce. I know how hard it is to be in a relationship where you can't communicate, where you don't understand one another. I know that pain. I know that pain really, really well. So I started college 4.5 years after we got divorced. I did my bachelor's, my master's, and my doctorate, all back to back. The boys were very supportive of me. It was just incredible. My middle son actually tutored me in algebra for my undergrad because I got stuck and couldn't figure out how to do it. He was in middle school at the time. Such a funny time. Anyway, did it all turn out okay? Well, I'm still facing dragons, but I did very happily, I can tell you, that I did fall in love again. I finally gave my heart away and could embrace my identity as a hopeful romantic. We had so many wonderful, wonderful times together, and I have great memories. I should say, I don't like to, but it's true. We had some rocky times, and knowing what those rocky times were like and being aware of how men are, being aware of how couples work, it was much, much easier for me to navigate those conflicts and those differences of opinion that we had. But it didn't last long enough. He actually passed away in December of 2022. So I miss him a great deal. It's been a tough transition to realize he's gone, but I am bound and determined to make the most of what I've learned in the process, and I learned so much from him. I finally figured out what it was like to be cherished, to be loved, and to be accepted for exactly who I am. It was a wonderful experience, and I want you to have that one too. However, we're back to now your dragon. You know, we all have them, and that's why you're here, because your love story actually matters. I believe my love story matters, and I believe yours does too. You have probably faced some personal challenges. Yours may be different than mine. They may be very similar, or they could feel like they're exactly the same, but we still all have personal challenges. In that process, we also have relationship challenges. That's why we go to couples counseling, right? And then sometimes even we have problems within the counseling experience. And that's what I want to talk with you about today and teach you about so that you can have a better experience. I don't accept counseling clients anymore. I closed my clinical practice in August of 2021. It was in Southern California, and I moved to the middle of nowhere, Texas. I live on a country road, but I still love to teach, and that's why I'm here, because I want you to have the tools you need to fight the dragon with or without a counselor so that you can have the best life ever. Now, you have choices. I had choices. Sometimes we make good choices, sometimes we make bad choices. They all shape our character and become part of who we are. So it's not a bad thing. The first reaction that we often have to some sort of a challenge is that we are afraid. And when we're afraid, we want to avoid. And if we stay stuck in that pattern for very long, then we become a victim of our circumstances. The other option we have is to get angry and to attack. If we stay in that position for very long, then we become the villain in our story, not a place we want to be. Now, I gotta say, being the victim and being the villain are not a place where you have to live, but avoiding and attacking are part of the process of adapting, of coping with life. So those in and of themselves, avoiding or being aggressive, those are things we have to learn to navigate. Ultimately, what we want to do is we want to be able to approach that challenge. And I wrote this slide particularly for men because men love to be the hero. And heroine looks kind of funny on there because it looks like a funny word. But we can be the heroine of our story, and we can partner with a spouse to be the hero and the heroine together. Pretty cool stuff, huh? Let's go on and look at some counseling models now. There are individual models for counseling, and I'm going to talk briefly about 3 types of those. One of them is just open-ended. It's where you've got a counselor, you can go, you can talk about whatever's on your mind. It's kind of a personal growth model. Sometimes you're not even aware of what's going on in your individual counseling. However, if it's open-ended, then there's not really any specific goals that you have said, this is what I want to work on. Oftentimes it's just more free-floating. And I have to tell you, that's really how my own counseling felt. I started my individual counseling when I was raising my boys. I'm a single mom, going to college, working multiple part-time jobs to try to make ends meet. It was really tough, and I put myself in individual counseling, and it felt very open-ended. I'm sure my therapist thought about it quite differently, that he had goals. I probably did too, since I'm a goal-oriented person. There are some times that you go to counseling and it's time limited. Now, when I did counseling at the University Counseling Centers, and I was on staff at Biola, I was also on staff at the University of Kansas, obviously. Those were more time limited in that when I left, my work with my clients ended. Other times you might go to time-limited counseling if you've got a particular issue and your insurance will cover, say, 10 sessions. So you've got 10 sessions to work on your goal or to be in there, and then you're done. You have to move on, either find another counselor or see if you can get an extension on that. But time limited is also another way to go about individual counseling. Finally, goal oriented. Some people go to counseling for a particular reason. For instance, I might have a fear of flying and I want to get over that. So I engage a therapist to help me learn to cope with that fear of flying. And once I'm able to fly, and I don't need the therapy anymore. So there are a lot of different ways to approach it. These are just kind of skimming the rocks across the pond, if you will, in terms of individual therapy, because we're going to focus in more on couples. And what that looks like is very different. You can have open-ended couples therapy. I actually had a colleague who worked with one couple for 5 years, and they felt like they weren't getting anywhere, so she referred them to me. It took about 6 months, and we met some of their goals, and they moved on. But it was very open-ended. That's not usually a very good model for working with couples. Doesn't get you anywhere. You end up kind of just mediating arguments as the therapist, and as the clients, you don't feel like you're making any progress if it's just totally open-ended. Another type is cognitive behavioral, and this is a very, very, very popular model. If you've heard of John Gottman or the Gottman method, that is one approach to working with couples that's phenomenal. The research, at the time I studied Gottman, he had more than 30 years of marital research to draw on, and he wrote some really great books, 7 Principles for Making Your Marriage Work, lots of workshops, lots of things. He trains therapists in the Gottman method. Basically, it's, what are you thinking and what are you doing? So it's cognitive behavioral model of moving forward. My favorite model is actually emotionally focused therapy, and I have more training in that than in anything else. So emotionally focused therapy is based on attachment theory, where the goal actually is connection. With cognitive behavioral, it can be a number of things. With emotionally focused therapy, it's always about recreating the close emotional connection. So if you've got an emotionally focused therapist, that's where they're headed with you. Now, I tended to blend all of these together. I was not very open-ended. I was always very focused. I used both Gottman and emotionally focused therapy. The person I studied most in that was Dr. Sue Johnson. She's got some great materials, including Hold Me Tight, which is about, I think it's 7 Conversations for a Lifetime. Another great book that you might want to check out. But I blended all those together with what I call the missing piece, and we're going to get to that in just a little bit. So I've got some skill in both of those. I know Gottman's research pretty well. I use it in my work with couples, and I use it in all of my courses that I'm training in too. So if you hear some of those terms, you'll know where they came from. Let's talk about the counseling process. This is a choice that you get to make with your mate. Now, most people make that decision initially on whether or not they have the time and money to get into counseling, and that can be a serious consideration for some folks. It might mean you have to use your insurance or you don't get counseling. You got to realize, though, in that process that counseling is what is paid for by insurance is based on a medical model. That means somebody's got to have a clinical diagnosis. Somebody's got to be depressed or have an anxiety disorder or something going on in order for the insurance to pay for it. And in that case, they're only going to pay for family therapy. They don't call it couples therapy, they call it family therapy, with or without the patient present. So one person has to be the identified patient if you're going to use your insurance. A lot of couples counseling, though, is done outside of that, where you're paying for it out of your pocket. And it can get quite pricey. Some people charge anywhere from $250 to $500 a session. So it can be very expensive. And you can see also, if it's open-ended, You could spend tons and tons of money in the process and sometimes not really get anywhere or feel like you're getting anywhere or see any improvement in your relationship. So that's really important consideration and the one that most people take on first. The second situation, which I believe is more important, or it's at least important for anybody that's going to help you, whether or not you're going to pay somebody to help you, is do you feel safe with that person and do you believe they know what they're talking about? So safety and knowledge are crucial. Now, that's not just safety for one person. It's safety for both people. And both people need to believe that the person who's helping knows what she's talking about. Otherwise, it won't work. Next, we want to look at the problem and the solution. Are you solving a problem? And what is the problem? Pretty important to identify what that problem is, right? How can you fix something if you don't know what's broke? The path of counseling is an interesting one. As you can see, this road is very swervy and curvy, and it's kind of going uphill even. So at the start, everybody starts in the same place, no matter what kind of situation you're in. You're going to start with de-escalation. Usually emotions are running very high. People get triggered very easily in a counseling session. And so de-escalation is the primary path that you begin with. It's the longest segment of working on couples counseling. Yeah, I would say if your counseling is, the process is this long, then de-escalation is going to take up this much of it. This little last part, the easy part, is actually learning and practicing new skills, and then finally consolidating all of it and putting it into practice in your real life. I don't believe people should go to couples counseling forever, but that's just me. A lot of people think you should get to go to counseling forever. I was trained that you deal with whatever it is, you learn what you need to learn, and then you move on. In fact, most of the couples that I worked with, the average time that I spent with them in therapy was about 6 months. I had a few couples that went up to 2 years, but they had some pretty extensive stuff going on in their individual backgrounds rather than in their relationship. So the process took a little bit longer, but 6 months was pretty much the bottom line for most of my couples to do that. What does the pattern look like? Well, you go into a session, and this is the first thing that the therapist notices is that there's a problem. I mean, you notice there's a problem too, but you don't always notice the pattern. But the therapist is watching for who makes the first approach. Does a husband approach? Does a wife approach? And then what's the response to that approach? Generally, if the problem is brought up harshly, in a negative way, with some accusation attached to it, even if it's very subtle, then the other partner will begin to feel attacked or blamed or criticized. And in response to that, they do what everybody would do. They avoid, they defend themselves. That's just a natural response to being attacked and blamed. Then they tend to counterattack. Remember our little arrows about avoid, attack, and approach? This is really where this comes into play. It's those decisions that you make, but in that intimate relationship, they happen very, very quickly without your full awareness of it. And once that counterattack has been launched, then you start to repeat the cycle because it becomes then a new problem. And round you go. So the first part of the process is recognizing the pattern. You cannot change something if you don't recognize the pattern. In each session, you're going to go through different stages of the process. So in the session, most everybody walks in feeling escalated. So the biggest lump of time you're going to spend in de-escalation. If things go well and you can de-escalate quickly, then you're going to do some learning and some practice. You'll learn what hopefully your therapist is teaching you some skills, is teaching you some new ways to look at things. And if that doesn't work, then guess what happens? You drop right back down to de-escalation. And I've had some clients over the years who spent many sessions just trying to de-escalate. So it may take, you know, 5 or 6 sessions to get things calmed down enough to be able to listen and learn and actually practice things with the ultimate goal, again, being connection. So you're going to repeat these steps over and over in each session, but they're also the pattern, as we saw with the road, that they're also that pattern that you're going to go through to get you to your end point, which in my opinion is connection, which is the foundation of all relationships, is being connected. Now let's talk about the missing piece, and that is the perspectives from which we approach couples counseling. Most of the time, it's the wife who wants counseling. Not always. There are some men who push for counseling and have for years. But in general, it is women who bring counseling up to their spouses, who encourage them to go. And once they get there, it's kind of like they expect the counselor to fix their husband. Now, if the counselor is a woman, she's going to probably agree with the wife. Not always, but sometimes. And when she agrees with the wife, then she is indeed going to try to fix the husband. However, there are also a lot of male counselors who will take that perspective because they are kind of afraid to bring up stuff to the wife. I remember talking with one of my colleagues years ago about my approach to working with couples, and he said to me, I could never be that direct with a woman like you are, because if I was, she'd never come back. And I was like, wow, he's probably right. So men end up kind of recreating the patterns that are already there because they don't want to upset the woman. They don't want to make her angry. They don't want to hurt her feelings, which is the same thing that the husband wants. He doesn't want his wife upset. He doesn't want to hurt her feelings. And so both the female counselor, by understanding the female perspective, tends to look at the man as being the problem. Also, the man looks at the man as being a problem because he doesn't want to upset the woman. I know that's a very generalized statement, one that I kind of hesitate to make, but it comes out to be true so many times in so many ways. The biggest perspective that's missing in most couples counseling is a way for the man to be able to engage in the process so that he feels safe and he feels respected and he can bring what he has to offer. Now, that hasn't always been the case. We've had a real tilting of the scales in terms of the perceived power of men and women, something that doesn't have to exist if we just understand that we operate very, very differently from one another. So just keep that in mind, that could very likely be going on. Not necessarily, but if it is, you want to notice it. Now let's talk about core beliefs, because that's also missing. We have our ideas about the way things go, and I think one of the reasons that the scales have tilted so far in favor of women is because of what they're now calling the patriarchy, which in the old days we just called sexism, which is that men have all the power, men have all the rights. We flipped that around, back in the 60s and 70s and beyond, with a focus on feminism, which is what the woman wants is more important. And now she is trying to take over the power, and she actually has way more power right now than the man does. But it doesn't have to be that way, that sexism and feminism, it doesn't have to be a battle like that. If we just look at the simple fact that men and women are different, they always have been and they always will be. Sexism and feminism are about who has the most power. And I think who has the most power is the one who recognizes those differences and honors them, which is the approach that I try very hard to take. I know in some of my videos, it can look like I'm skewed in one direction or the other. And I've certainly been attacked by men and by women on different videos thinking I was either a sexist or a feminist. I'm neither one. In reality, I'm a pragmatist. Men and women are different. Let's figure out how they're different. How do they use language differently? How do they look at the world differently? Because they develop differently. They have different biology, different life experiences. They're trained to handle emotions differently. There's just so much different. So why don't we learn each other's languages, and come to a common ground and practical solutions to everything. Now, I'm not saying we're erasing men or women. What we're doing is we're blending them together into a team, which is what I think couples counseling should be about. Because you can't have connection if you don't have a team, if you don't have partners with equal value and equal respect, not that they're the same, but honoring the fact that they are indeed very, very different. So, with all of this said, we've talked about the process, we've talked about some of the underlying assumptions, the philosophy of sexism, feminism, and pragmatism. What do you do to get better results? Well, if you're looking at the model of couples counseling that says that you're about connection, then what you want to do is you want to take the person who is disconnected in the relationship. That tends to be the person who is the most avoidant. You want to get them engaged in the process. And when they engage, then you can connect. Sounds simple enough? But most often what I found is that it's the man who is disengaged. Again, not always. Sometimes the woman is the one who withdraws and defends and protects herself. But people disengage for a reason. We don't always realize what that is if we're the one they're disengaged from, right? So if someone's disengaged from you, you want to learn as much as you can about what that reasoning is. And in the process, if you're working with a therapist, they're going to try to get that person to engage. They won't be able to do it if they don't have your partnership. And that's where you can greatly influence that outcome, is by partnering with a therapist in the process. And if you don't have a therapist, you can still do this. That's what's really, really cool. Man or woman, you can do this next step, which is you give the person space to engage. If someone's disconnected from you and you're trying to get them to engage with you, then you're going to be pursuing them. You're going to be after them constantly, trying to get them to respond. And those efforts are going to make them pull back even more. You need to recognize that. And in the process, hopefully, you're learning in the process of counseling what that looks like, what specific behaviors you're doing that causes that person to pull away. Stop the behavior, give them space, and watch them fill it by engaging. Now, if you don't get in too big of a hurry, you will be able to connect because they're actually present in the relationship. But sometimes when we get to that point, and just back it up here a little bit, you're giving them space, they come out of the woodwork, or they get off the sofa, or they start talking, then the person who's the pursuer gets really excited and they want to start talking again right away. They don't realize that that factor of safety hasn't been established quite yet. And so they end up, the person who engaged for a minute now pulls back and doesn't want to engage anymore. So you have to continue to give space. Doesn't mean you don't talk. It doesn't mean you don't bring things up. It just means that in the process, you're really aware of your partner's reaction to you. The words that you use, are you attacking, blaming, and criticizing without recognizing that you are? But stopping that and pulling back, if you say something harsh, you can say, I'm sorry, that didn't come out right. What were you saying? Now the engaged person feels safe to speak up again. Okay? So again, the goal is connection. Without connection, you don't have a relationship. Or you have a relationship, but it's not a very good one, right? What if there's downsides and upsides to every situation? I mentioned in the beginning that you might already have a counselor. You might be wondering why it's not moving along very well. Maybe your mate doesn't want to go to counseling. Maybe you can't afford counseling. Maybe you've got some more serious issues, and that's really one I want to take a minute to talk about here. And the downside and upside to both of those things, or to all of these things, is that you can find help. In fact, some of this help that you can get is actually free, so that's a good thing, right? Again, we're back to the dragons, and what are your dragons? Well, if one of those issues is abandonment, then it's going to be really hard to engage in couples counseling if your partner's not there at all. So if they've left, they're gone, there's nothing you can do but work on yourself. So the upside of that is that you actually can spend time working on yourself because your partner is no longer there. The next thing to consider is abuse. If there is abuse in the relationship, you really do need to work with someone individually. I would never do couples counseling if there's a case of domestic violence or abuse going on in the relationship currently. In addition, if there's been abuse in the past for either partner, there might be some individual work that needs to be done, things that need to be talked about that your partner doesn't necessarily need to hear and go through with you, but that you need to address so that you can be available to engage in the process of a healthy marriage. The next thing is addiction. Now, this is the one that it is super easy to find help for addictions. Super, super easy. Almost as easy as it is to find an addictive substance. Maybe actually equally available. Again, you're back to choices. You can choose what you want to do with it. But if you have an addiction, you can get free help with Alcoholics Anonymous or Celebrate Recovery. If your spouse has an addiction, again, you can go to Al-Anon, you can go to Celebrate Recovery. Both of those things are absolutely free. And if you've got those issues going on, I highly encourage you to be involved in those programs that will help you see not only what your spouse's problem is, but how you tend to contribute to the cycle that drives that. Now, before you hear that wrong, I'm not saying that you cause somebody to be an addict, but there is a pattern, again, of things that happen in an addiction cycle that it's important for you to understand, and learning about that is absolutely free with those programs. So I encourage you to check that out. Then the final one is adultery. Adultery is incredibly, incredibly painful. It is, I believe, the most horrific pain that you can experience is to have your spouse be unfaithful to you. Women have a really hard time getting over it. Men sometimes never get over it. And there's reasons why I think that is. But again, this is going to be a reason that you're going to need to get some individual work to be able to prepare yourself for that. So the upside is that on all of these things is that you have real power and there's nothing holding you back in finding the help that you need for any of those things. If you've got questions or you don't know how to connect, please let me know. Again, you can put comments down below. You can email me separately if you want to, but there are things that you can do. And I want you to have the best life that you possibly can. So please don't ignore those things. Knowledge is power. This is just so true through the whole thing. The whole reason I'm doing this masterclass is to give you that knowledge about what does this process look like. Now, I know I haven't been able to cover all of it. I've just given you a sprinkling of things, but it's a start, right? So we have to begin somewhere. And in that, you came here because you wanted to learn about couples counseling, so you're interested in marriage. What is a marriage? How does it work? What makes a healthy marriage? What are the characteristics of that? For women, do I have to lose myself to be happily married? For men, do I have to spend my whole life just trying to please my wife to have a happy marriage? Those are really good questions and things you want to have the answer to. I often start with women because without women, there is no relationship. You go back to Adam and Eve in the garden. It didn't start with Eve. It started with Adam, but human relationship started with Eve. So there's a lot to learn about women and how we operate, how we can have our best life, the things that make us more powerful. And what makes a woman powerful is not the same thing as what makes a man powerful. We often think that, well, if I want to have power, I've got to act like a man. And it will not work. It will not help you at all to do that. On the other side of that also is the man. How does he operate? What does he think? How does he feel? And why does he do the things that he does instead of what you think he should do? Those are important things to know, important things for you to learn. And that's why I'm here to help. Maybe you wonder whether or not you need counseling. Maybe your mate refuses help, yet you're determined to grow. Maybe you're in counseling now and you want to speed up the process. Maybe you can't afford counseling and you're searching for answers. Or maybe you just want to learn more about life and love. As I said, I'm not here to get counseling clients. That's not my purpose. That's not even what I do anymore. But instead, what I want to do is help you understand how life works. Real life, that is. Not the storybook life, not the one that you see on Instagram or whatever, but real life with real bumps and bruises, with real dragons, with real problems. And how do you find solutions? How do you stay on track? How do you stay upbeat and become who you're meant to be? And then true love. How do you find true love? How do you nurture true love? How do you learn about the opposite sex? That's a big topic and one that I focused a lot of my energy on. Even so, there's another layer to this, and that is fulfilling our dreams. Each of us was placed here on this earth. Each of us was created to do something, to fulfill a particular purpose. And sometimes we don't even know what that is. And it doesn't have to be what I'm doing. My purpose and my dreams have changed over the years. There was a time I dreamt about getting married. There was a time I dreamt about having children. There was a time I dreamt about going to school, falling in love again. For all those things that I went through, and now where I am on the country road in the middle of nowhere, Texas, this is a different type of dream for me too. So you don't have to have the same dream I do, and your dreams can change from time to time. But you need to be aware of those, where they come from, and what you can do about them. So what do you want from life? You want to feel more alive? You want to be deeply connected? You want to make a difference? You want to live in love? All of those things are incredibly possible if you have the right education and the right tools and the right support. And I'm not here to be your counselor. I'm here as an instructor, as a teacher, to help you understand how the process of life works. And remember, I'm here to help. Thank you so much for being here. If you've got any questions, do reach out to me, and I'll see you again real soon. Take care. What did you think? Did the information raise more questions? Do you want to learn more? Head over to A Wise Woman's Guide for show notes and links to the resources mentioned in this episode at awisewomансguide.com.